Hi, it's Tuesday, and it's been a great week so far, an interesting week. Yesterday, I spoke with a group of nursing students. Once a quarter, I do a talk. It's probably a misnomer to think of it like a lecture to a group of nursing students at a local college that we've partnered with. We're doing some research with the college. We take nursing students down once a year for a big project, and nursing students who are going back to school, who have their RN and are going back to get their Bachelor's of Science in Nursing, are eligible to do international rotations through HealthBridge International. So we have a very good partnership. Yesterday I spoke at the school. And, it's interesting because when you talk about the work you do, it really makes you stop. It causes, at least I should speak personally, it causes me to pause and to really reflect on the why part of the work we do. And I find that when I talk about HBI and the work we do, I find it very empowering because I have to think through, why do we do this? Why do we believe in the collaboration model? Why do we believe that it's much more powerful to work with people, alongside them, walking with them, than to do projects for them? Why do I believe that ultimately the most important legacy we can leave to the world is to help to train the next generation of change agents, to help doctors and nurses and dentists and pharmacists and healthcare professionals have the skills they need to best serve the people they're called to serve? Why do I believe that? And this talk that I did yesterday really gave me an opportunity to sit down and reevaluate why we do those things. And today something happened really interesting. I was coming out of a business, visiting. I had our dog with me. I was walking across the street, and I happened to see a group of people standing on the corner. One woman was on the telephone. I could see her, and she was very frustrated and saying, "I don't know what's going on." And I turned around and looked, and I could see that she was speaking about a gentleman who was crawling across the road. And she was talking to an emergency dispatcher saying, "I'm not sure what's going on, but it looks like he's very sick. It might be drugs. I don't know," she kept saying. She got off the phone, and I walked over to her and I said, "Were you talking to the police or to EMS, to Emergency Management Services?" And she said, "I called the police and they said they were going to send someone." I thought, why don't we just go talk to the guy? So I walked across the street. He was now crawling across a parking lot. He at some point stopped crawling, and I said, hey, I'm coming up behind you. I just want you to know, and I've got my dog. Are you all right?" And for about 20 minutes, I sat and talked to him. Gentleman whose business parking lot he was now lying in came outside and said, "Hey, I'm sorry you can't lie in my parking lot." And we talked to him. We just said, "Are you okay? Do you need any help? What's going on?" And it's amazing what happens when you treat people like people. Eventually, he stood up. He said, "I'm okay enough, and I'm going to be okay. It's been a rough day. I drank too much. I just need to go home." And he turned to me right before he left, and he said, "Why did you stop and help me? Most people just kept walking by." And I said, "Because we're in this together. Because ultimately, we're connected on some level." He walked a couple feet, he turned back around, and he said, "Hey man, keep doing what you're doing. You're doing the right thing." And I thought, we are doing the right thing. HBI is doing the right thing. We're trying to be available in the world. And it's hard. It's not easy. There's a lot of struggle to assure that we have the money, the resources to be able to do the work we do. There's a fair amount of struggle to assure that we can justify that the work we're doing has evidence and that it's worthy of funding. But ultimately, every day, it's about helping people. And I'm proud of the organization we created, and I'm proud that we put helping people first. This next couple of weeks, I'm going to talk about our programs. I'm going to really try and help people understand, what are the programs of Health Bridges International? What exactly is Health Bridges International? And how can you get involved? So thanks. have a great week. Happy Tuesday to everyone. And don't forget, we're all in this together.